Good evening and welcome to the Healthy Debate. My name is Lindy Naughton. On this show, we are committed to encouraging open debate on topics relating to health with guests from all sectors of Irish life. At the moment, the agenda is obviously dominated by the ongoing COVID-19 crisis. The material we're showing you is not available on the mainstream media, so to show your support for what we're doing, please press the share button on your screens. Tonight, we're looking at nursing homes and whether the restrictions they're imposing on their vulnerable residents and their families are in any way justified. Our guests include Dr. Marcus DEBRUN, who we'll speak to later on, and two women who have family relatives in homes and will tell us their stories. So let's set the scene. Only today, HIQA, which is the Health Information and Quality Authority, which in plain English means the Health Services Watchdog, published its report on a Clonakilty care home. Its description of conditions in the home were absolutely horrendous, is the only way to describe it. The residents were packed into bedrooms, 3 and 7 of them into single bedrooms, where there wasn't even enough space for a chair between the beds. Their personal memorabilia and so on was only put above the bed, so they couldn't even see it. They've since reduced the number in the rooms to 4, but it's still not satisfactory. They left the beds in there, so these poor people, they're in these rooms all day, every day, apart from meals. I mean, this is a form of incarceration. The inspectors were pretty tough on it. The way they put it was that, and I'm going to have to read this, the bedrooms, quote, did not support residents receiving personal care in a manner that protected privacy and dignity. So that's pretty hard hitting from a public inspectorate of that nature. Now, in that home, 10 residents died at the peak of the virus epidemic, whatever you like to call it, last April. But we have to point out in this discussion that people die in nursing homes. It's the nature of the beast. The big question concerns the right of the residents to making decisions about their own lives. These are people who may be physically frail, but who are mentally all there and perfectly capable. Not all of them, but a lot of them are perfectly capable of making decisions about their own lives. These people, they do not want to be patronised and they do not want to be, quote unquote, protected. They want to hug their children and their grandchildren, and they're quite prepared to take the chance. I think it's absolutely dreadful that they aren't allowed to make this choice. But the big question remains is, has anybody asked them what they want? Is anyone listening? It's absolutely horrific. So our first guest this evening is Susie Buckley, whose story is not a happy one. She's a Dubliner resident in County Kerry, and her father has early onset dementia, which she'll tell you about it. He's been in care for many years. We'll watch one of Susie's videos and then you'll see a pre-recorded interview with Susie. Be warned, it's tough stuff.
This is my dad, and what I'm doing is illegal. I am holding his hand through the window. And this is all I can do to see him, which is pretty bloody sad. Because he's got dementia, I can't even talk to him. Now, the nurses here are lovely and everybody is really nice, but the bloody rules don't make any sense, so I have to stick my arm in a window. That's all I can do, see him through a frickin' window. This is inhumane, and it doesn't make any sense anymore.
Susie, our viewers will have just seen a film of your father who's in care in the Greater Dublin, Meath, Leinster area. Could you tell us the story of his time in care, please?
My dad is just gone 64 years of age on the 15th of September, which makes this a bit of a tragic and not a nice story. He has been in care for the better part of 4 years. He was in a private nursing home for 3 years until last January. And he was extremely highly medicated in that nursing home. So for that 3 years, I never got a word out of him. He couldn't speak and his eyes would roll in his head anytime you met him. He was put into a HSE facility last January. And one thing I have to say is the level of care and the nursing staff that are there are second to none. He's getting a lot more attention, and he has been able then to vocalize and speak in bits, but you can understand him since that. So that's been massive to be able to actually, after 3 years, have a conversation with him, or some kind of a conversation. His history wasn't very pretty. He was an alcoholic and he had drug issues. So the form of dementia and Alzheimer's that he has is not nice. It's very degenerative. He's in full-time care. He can't move. His arms are twisted. You can see that from his legs. So the last time I visited him in face-to-face was February of 2020. And after that, the next time I get to see him in person was the 22nd of August of this year. And in that time, he had shrunken away to nothing. When you feel his arms, you could feel the bones coming out from his clothes. You can feel the bones coming out from his clothes and his legs. I understand when somebody is not moving that they lose weight, but he was previously in a nursing home for 3 years and I didn't see that degree of weight loss in him. And I was extraordinarily concerned when I saw him in August face to face, third time this year, because I saw him again in September. And that was the last time I saw him face to face. And I got to meet his care team. And I found that experience highly traumatic. There were 5 members of the care team, which involved the nurse. There was the nursing manager. You had the manager of the care centre, the nutritionist, and the doctor. And I have a medical exemption for wearing a mask. And I was told by the doctor that if I didn't wear a mask at the meeting, he would leave. And he clearly saw me for the duration of the meeting struggle to breathe, pulling at the mask. And he said, if you pull at that again, if you don't fully cover your face, I will leave this meeting. So I'm just a little bit confused where the care and the dignity in regard to anybody in this situation is, because there doesn't seem to be an onus on healthcare anymore. It's an area that I was trained in. So do no harm is a very important thing to me. I just don't understand why do no harm is not happening for the greater medical community at this point. When you stand outside a window with a parent that has this kind of condition, it's horrific, because it's basically like watching him slowly die through a window. And I'm not messing. If I went sitting face to face with him inside the care centre, they're a lovely team of nurses. They let me feed him. They let me do his nails. They let me massage his hands. And if you've ever grown up with an alcoholic, you will understand that in these kind of situations that soothes and distracts him. So I can go in for my visit for him or with him, and I can leave. And it's a nice experience. There's no drama. But outside a window, I have no way to soothe him. I have no way to calm him. And he can go through fits and spasms and bawls and screams. And because alcoholics have a bad history of not being very truthful, he can exaggerate things sometimes as well. And it's horrifically traumatic standing outside a window watching this every time. It's like I'm going up every month just to experience him in a more degenerative, skinnier version, which is horrific. I don't know if any animal would psychologically survive this, if there's any studies to see if an animal has been on one side of a window watching a parent die. But I don't think it's in any way healthy for humans. I'm in my 40s. My dad is 20 years older than me, and I'm watching him through a window in that condition. Now, fair enough, he has his condition because of his life choices. But we should not be in the position where there's more trauma and more suffering and more triggers and more flashbacks because of the choices that the HSE are making. So I contacted yoursay.ie after contacting the nursing home previously, and I asked them for some kind of dignity and compassion in regard to this situation. And what they, in brief, told me to do, this was the head nurse, was to have patience. But I think I've had plenty of patience at this stage. And the reality is that early onset dementia and Alzheimer's, it doesn't have any patience. So no matter how much patience I do have, the man that I'm eventually going to see, if we ever go back to any form of normality, will never be the man that was there a couple of months ago, because he's sliding away from life so much and so quickly.
So what is your legal relationship with your father? Are you his official guardian?
I'm the oldest in the family, but I live in Kerry. So my youngest brother, my only brother, is his official carer, because he lives quite close to the nursing home. So it only makes more logical sense that he can be the main carer, because he can go and he can visit on a daily basis and he can have access to him more regularly.
So your brother is your brother is going to see him through a window still at the most days now, or what's the situation today?
So the situation is at the minute that they have given permission to one family member to have access. Now, my dad, up until the point that lockdown happened, comes from a ginormous family. He's one of 17 with 15 still alive. So his sisters have been very good to him, and they live in the local area, and they would come visit him on a regular basis. So he was very accustomed to a lot of visitors on a constant level, a lot from a huge family. So it also led to some animosity when the lockdown happened, because if you can only appoint one family member, who do you choose? And one of his sisters is a lovely lady, and she's just turned 71, and she is as fit as a fiddle, and she doesn't look her age at all, but she's not allowed inside anymore because of this situation. So humans need love like plants need light. I just don't understand the decisions, because it doesn't fit with any model of mental, emotional, or physical health care that makes any logical sense to me.
So how is it affecting you?
I'm rattled. I'm rattled. Like, I mean, I get to see my 87-year-old mother-in-law who still drives, who's still fully well able to look after herself and lives by herself. But then I get to look at my 64-year-old father in that kind of a condition, in a constant degenerative state. I'm rattled. I get also standing outside the window. When you're standing outside the nursing home after driving for 4 hours, there's no toilet provisions, there's no cover, you're standing outside in all of the elements. It could be raining. The last time I was there, it was absolutely freezing, and I needed to use the toilet, but there was no toilet. So there's the basic level of care that is lacking across the HSE in regard to the greater extent of how this is impacting people at this stage.
So, but before COVID started, you're saying that the staff were excellent.
Staff still are excellent, as in the managers, I don't understand. They've gone into military style in regard to their communication. The nurses are amazing. The carers are absolutely amazing. And he's very happy there. In his previous nursing home, he was cut on a constant basis. Every time he was shaved, you go in and he was cut all over. I've never seen one cut on his face. He loves the nurses. They give him a lot of care. They know he's hard work, but they have the patience of saints around him. And you can see that he's very comfortable. Like, I mean, he speaks, he gets little words out, which he never did in the other care home.
So, but still he's losing weight by seriously.
Dramatically losing weight.
Are they not feeding him or what? I'm sure they are feeding him. Or does he not want?
What he said is, well, he's losing his swallow at the minute. So, and he also would have been a very, very, very heavy smoker. So he chokes and he gags an awful lot. So he gets small portions multiple times a day. Okay. But he said that he's getting pains in his stomach, and they're hunger pains, because he doesn't feel like he's getting substantial. Now, his nutritionist went through it. She went through the calorie count. I work in food. I just don't work in calorie count and gels and sticky things. I just don't get them. I don't understand them. But she, on the nutritional plan, believes that he's getting enough calorific energy from the food program that she has him on. But she can't explain to me why he's lost so much weight and why he now is 65 kgs, which he's never been in his life.
Could he have another illness? Has he been tested for other illnesses? I'm
not allowed access to his medical files. I have approached the HSE in regard to getting his medical files, and I want to see his bloods. His doctor very quickly ran through his medications that he's on, and he's presently on more than 15 medications. So I think that's got to have a contributory factor to the fact that he's got other issues going on.
So what would you like to see happening? I mean, it sounds like an absolutely desperate case to me.
I would like to go back to some kind of normality. I would like the fact that I have a mask exemption respected because of a valid medical history. I would like to be able to visit my father. He has a private room in the care home, so it's not as if I'd be in a public area. I'd like to visit him face to face. I'd like to be able to hold his hand. I'd like to be able to calm him if he's freaking out, because he can be badly behaved sometimes. And I'd like to, there's one other thing that is hugely traumatic, and I've explained this to the nursing home and they don't seem to understand it, which is every single time, and that's every month, and that's every month since March this year, there's rule changes. So you get a call saying, sorry, the rules have changed now. You can do this, you can do that, you can do this, you can do that. It feels like I am spinning in circles. And I said it to the lady that rang last week. She'd go, you can go in now and you can visit him. You can just make your appointment now. And I said, what about the mask exemption? And she goes, well, you'll have to wear a visor. And I said, I have an exemption for the visor as well. Well, I'm sorry, you'll have to visit outside the window again. And it's just like circle after circle after circle after circle, where I don't believe they're looking at individual cases. I believe that they're treating everybody like cattle, and we have to fall within the rules of what is being dictated to the health boards from the HSE, which does not make sense to me. I believe that people that are in the last stages of their life, which I can clearly show people through the video my dad is in, would appreciate to have his extended family and siblings with him in his last stages, as opposed to screaming through the window going, come inside, come inside, come inside, not understanding, because how can his brain comprehend what our world has turned into in the last 12 months?
I think we'll leave it at that. All I can say is I wish you the best of luck. My father had dementia as well, but not to any degree. He was brilliantly well treated, and I think what's happening is absolutely horrific. So thank you for sharing your story. Really appreciate it.
Lindy, I do appreciate you listening. Thank you.
Right. It's even worse to listen to it a second time, I can tell you. Thank you to Susie again. As she said, humans need love the way plants need water. Says it everything. Our next guest is MAEVE MURRAN, who is another tale, not quite as breathtakingly awful, I hope.
No.
Sorry. But Maeve, tell us your story about your aunt.
Well, I was with her today, Lindy. I've been minding my aunt for probably over 20 years. She never had any children, and she's surrounded by a loving family, very much like Susie. She came, I think, from a group of 13 children herself. They lived in an artisan dwelling in Oxfordtown Road, and you know, they had a happy life, but it was a very loving life, and she was used in her years with being in the nursing home. She only went in, I think, in 2018. So she was surrounded by loving family, friends, relatives. And we would all, as a group of cousins, myself and my cousins, take her out regularly. They take her out at weekends. We take her out during the week shopping. You know, she loves style. She loves the little bit of glam. And, you know, then suddenly COVID arrives and it all stops. And it was really very difficult because we all absolutely love her. And she used to sing in a band. You know, she's a real character. So really how it all happened was she got COVID, and because I'm in the alternative business, I sort of negotiated with the home. And may I preface this by saying, very much as Susie said, the home she's in are excellent. You know, it's spotlessly clean. They're very caring. She has a nice room. She's well looked after. I have no complaints there. But the situation is now, since COVID, she recovered really well because I gave her vitamin C and they gave it to her, and I think she was already on vitamin D drops. So she actually didn't fare very badly with COVID. She had an elevated temperature and a slightly elevated heart rate.
What age is she?
She's 89 and she'll be 90 in March of 2021. Right. So she has quite a good degree of health. I mean, obviously her brain isn't as good as it was. You know, there'd be some faculties there that aren't as, I suppose, as quick and that. But generally she's quite well. But of course, since the isolation, that's all changed. We're obviously not able to go in. Now, to be fair, they have been very good, the home, and they've tried as much as is possible to facilitate visiting. But we went through similar stuff like Susie, which was standing outside windows in all elements with chairs that they gave sinking in the mud on wet and rainy days. But since that, they've done their best to try and arrange for visits. And like currently at the moment coming up to Christmas, this is the big issue. We want to take her out.
Exactly, yeah.
You know, so it's very difficult because they feel very fearful that obviously we take her out for the day, there's issues with reinfection. My own sense is that these are the three tenets that I feel people need to actually really start really questioning, which is asymptomatic transmission something that's actually going to happen to her? You know, and at 89, is it a risk versus benefit analysis thing? Like, do we look at the risk and say it's worth it for her to get out and be with family? She is living for it. Yeah. Every time we go in, that's her big motivation. I'll be out for Christmas. I'll be out for Christmas. So it's really, really difficult. She's going to be really disappointed. And I was there today and we tried to broach the subject, but there's almost an unwillingness to actually take that on board.
From her or
from her, yeah, from her.
The nursing staff?
No, the nursing staff, I can understand. It's very much as Susie said herself. They're very kind, But there's this fear from, I believe, the HSE dictates and guidelines. They're very much have to actually adhere to everything. And the fear is that she comes out, that somebody in the group gives it to her, even though they've no symptoms and they're not sick.
But she's had it already.
Exactly. Yeah. I don't understand it. Yeah. I mean, I'm assuming that she would have some immunity to it.
Yeah, exactly.
And she has quite good health, but also I see there's quite a failure in her cognitive and her mental abilities. And I think that's a lot to do with the lack of stimulation. I'm not saying the home are good and they try to do the best they can, but like when you have a woman who has 8 nieces and nephews who come in and out all the time and take her out all week long, to going to nothing really except the odd activity in the home, and people who are not directly related to her, who are not her loving family and relatives, there's a massive loss, you know, of mental stimulation, of love. And I haven't been able to hug her since last February. None of us have, you know. So for me, that's the really sad part for Frances. It's just sad, really. And I feel so sorry for her. I mean, she's healthy, and I feel she could quite easily make the choice to say, look, I want to go out. I'm 90 next year. I'm in my twilight years. I don't have time to waste.
Yeah.
You know, so.
Well, I think one of the big things with this is that elderly people, like I've an aging relative myself who's 85 and a very feisty woman, and she's pointed out that you once you're into a nursing home, it's endgame really. So we shouldn't be getting too sentimental about what goes on there. But the restrictions are robbing elderly people of a significant portion of what's left of their lives, and forcing them to live under circumstances that are, I mean, prisoners of war are treated better from what I can see.
Yeah, and I mean, the other thing that I'm fearful of is, you know, there's very little in the way of treatments being looked at. I know for a fact that, you know, there's elderly people with serious underlying conditions who were treated with things like hydroxychloroquine, azithromycin and zinc and survived. And there's huge evidence that there's other things out there. I've heard of ivermectin this week. I mean, there's a lot of things that could be investigated that would allow these old people to go out, and even if they got it, could be treated very quickly and very easily. So it would provide a huge sense of safety for relatives who have it in their head that they may be going to cause their demise. Because even within my own family, I personally feel for her the risk would be worth the benefit. But I would have relatives who would be very concerned because they have older relatives. You know, but I feel she's very safe. She's been in a home. The staff are tested all fortnightly with nasopharyngeal tests to make sure they're COVID negative. So she's in a very safe space. She's had it. And, you know, even if they did take her out, my fear would be, and the home would probably have to do this, quarantine her for a full fortnight in her own room on her own. Is that worth it for her? I mean, I actually think to myself, is that actually worth it for anybody to get a few hours on Christmas Day and then to end up 2 weeks locked away in her room?
I just think we've ended up in the wrong side of Alice in Wonderland's, whatever it is.
Yeah.
Gone down the rabbit hole big time. But I suppose this would be a good point to bring in our third guest, who's Dr. Marcus DEBRUN. Are you there, Marcus?
I am indeed, Lindy. Can you hear me okay?
Yeah. So, Marcus, you resigned from the Medical Council very early on in the start of all this, what I can only describe as nonsense. I'm sorry if anyone's offended by that. On the grounds that people in nursing homes were not being treated with the dignity and respect that they deserved. Am I right there? Have I got that right?
Yes, you're absolutely right, Lindy. I think in my own opinion now, having kind of nearly gone through the year of the process, I think that what happened in the nursing homes is perhaps the key to kind of understanding, I think, where we are today. You know, I think, you know, most of us will probably remember back at the start of the crisis, there were some catchphrases being bandied about by RTE. It was kind of do your bit to protect them, or we're all in this protect yourself to protect them, you know. But the them at the very outset of the crisis were the elderly people, was the elderly population of Ireland, particularly the nursing home residents, because that's where you have obviously the unwell elderly people. And we knew long before COVID arrived in Ireland that the most vulnerable cohort of people in our population are going to be the residents of Irish nursing homes. But, you know, something very strange happens very, very early on into the process. It very soon stopped being about them and started to be about us. And the narrative very, very quickly changed from a disease that the disease as such hasn't changed in terms of its essence being still about them. It always has been about them. One only has to look at the Central Statistics Office statistics to see who COVID is about. It's not about children. It's not about young adults. There are no deaths of Irish children with COVID. There are no deaths of young adults with COVID, and we have very, very significant populations or underlying conditions in our young populations in Ireland. I've frequently pointed out asthma and cystic fibrosis. We've one of the highest rates of those in the OECD, but yet, so we've got lots of children with underlying conditions, but no deaths, But all of the regulations and the process and the guidelines and everything else very quickly changed from being about them to being about all of us. And I think what was happening at the time is that government was responding and reacting to fear. And essentially, I mean, politicians want to get re-elected, and their bread and butter is getting re-elected and getting votes. And it's a real pity, I suppose, on a deeper level, that our democracy kind of has come and evolved to function on the level that politicians react to media headlines, public fear, and they don't kind of they don't lead. They essentially follow misguided fears, because I mean, we were all afraid. We all saw the horrific pictures in Italy and that, but it took a certain amount of science, it took a certain amount of pragmatism, it took a certain amount of balance to look at those pictures in Italy and ask, well, okay, yes, this is very frightening stuff, but what is going on here? And when you ask those questions and kind of drill down, you even look at the Italian picture, it's still all about them, and the them, again, being the elderly population, being the vulnerable elderly population, not young, healthy children, not teenagers going in and out to school, not people who don't have underlying health conditions, but it very, very quickly changed. So politicians kind of fed into that, and established very quickly was a very, very strange ageism and a very strange anti-them, which was really bizarre. That's what I couldn't understand, that it started out, we had all of this narrative about protect yourself to protect them, and the them were defined. And whilst I was working with them in the nursing homes, with the vulnerable people, very, very strange things start to happen in Irish society. I mean, I'm a GP. I've been a GP for many years. And in April and March and April, whilst I'm going back and forth to the nursing home I was looking after, trying to look after my residents and test them and do things, strange things started to happen. Like, for example, the testing facilities for 3 weeks from nursing homes all across the country. Testing was pulled from the sector entirely across the board. If a nursing home had one COVID positive case for 3 weeks during the height of the crisis, so for 3 weeks from March 21st until April 19th, nursing homes were not even allowed to test the vulnerable people who are going to die from COVID. We weren't even allowed to provide them with tests because there was a fear. And again, this is when the politicians were playing the popularity game. There was a fear at the time that we were going to run out of tests. So tests were withdrawn unilaterally across the nursing home sector throughout the state. They were withdrawn from them, and they were held for the people who didn't need it. So I was in this very, very surreal situation where I'm going into the nursing home and I can't test them. I can't find out for relatives, for family members, for patient management. I can't identify COVID positive cases in the nursing home because I had one positive already. So I can't do it there. And yet I'm returning then in the afternoon to work in my practice, and I'm getting calls from moms who are a little bit worried about little Johnny has a runny nose, blah, blah, and she wants a test. And according to the guidelines, to the HSE state guidelines, I've got to put these people, put these children, put these families, put people down for tests. So here I am in this very, very strange situation where I'm in my practice dishing out tests for people who clearly don't need them. People were ringing me from the supermarkets looking for tests and out and about looking for tests. And I'm in the middle of them, where the vulnerable, in a nursing home with some 50 residents, and I was denied basic even access to testing. And it's not just me. This was a unilateral decision right across the state. So these sorts of things, and it wasn't just, it's not just that. That's horrific. And there's document. I mean, the evidence, the memo is black and white from the HSC telling us you're not allowed to test if you've got one positive case. You know, the evidence is black and white, and it's out there for people to find if there was an interest. But this is the kind of really strange thing. There isn't much of an interest. You know, during the crisis, we were kind of told that of the kind of 1,500 people who have died in Ireland from COVID-19, you know, somewhere in the region of 900 to 1,000 of those people died in nursing homes. And yet there isn't even an appetite for a public inquiry to look into what went on, you know. And it wasn't just simply a withdrawal of tests because we were worried about the kids and everything else, and we didn't really, maybe the old people don't need tests or whatever. Maybe, I don't know what the arguments are, because they wouldn't make any sense to me on any kind of ethical level, but there must be arguments because somebody must have come up with these decisions. But it wasn't just that. You know, I mean, whilst I was working in the nursing home I was caring for, we're all familiar with the old stories. They're old now, I suppose, the stories of not being able to get extra oxygen tanks for people who were going to die of respiratory failure from COVID, not being able to get end-of-life medications. I mean, nurses in nursing homes were taking masks home. In the nursing home where I worked, the masks had to be locked up because there was so much fear. There was shortage of PPE, shortage of masks, and masks and things like that had to be rationed out. They were being lifted from the facility because of the horrendous fear. So not being able to get drugs, not being able to get medications, not being able to get masks, not being able to access proper facilities, not being able to utilize tests. Then on top of that, I'm smiling, but it's more of a smile, I suppose, of amazement rather than humor, because these are terrible things that we're discussing, and very hurtful things for people who've had family members who've gone through this. But you know, in the middle of all of that madness, my nursing home, for example, had plenty of capacity because it was a new facility. So we had the hospitals were being emptied. So we had multiple people dumped, essentially transferred into the hospital, people with broken arms or whatever, for respite, to try and clear out the hospitals to make way for the surge that never came, that was supposed to come. But as those patients were being transferred into the nursing home, 2 or 3 days into this process, it emerged. I mean, I had assumed, foolishly, I'll admit, hand on heart, foolishly, I'd assumed these people were being tested before they were being transferred into the nursing homes, but they weren't being tested. And when I scratched the surface and was looking for test results for these individuals who were being transferred into the nursing home, none of them had been tested. COVID ripped through the nursing home that I was responsible for. 12, 14 people died of COVID. I had to deal, and the nurses had to deal, and the staff had to deal with horrendous situations with family members not being able to visit people who were dying, not being able to get questions answered. You know, so all of that's horror show. And that was unquestionably, I mean, I worked in Africa for a time during my training, and in Africa, in a hospital in the Gambia, during malaria season, when children were dying and people were dying quite quickly around me. But it brought me back to, in a first world country, back to a third world situation. And I couldn't understand why these people, them, were being treated like livestock, were essentially being manipulated, and tests being pulled away from them as if they were expendable. You know, and that horror show. This is why I said at the outset, when I started talking, I said I think that what happened in the nursing homes is the key to understanding what's going on here in the bigger picture. Horrendous, absolutely horrendous, grossly incompetent mistakes were made in the caring or supposed caring for nursing home residents. And those mistakes aren't even being, there's no level of accountability at the moment. And part of the reason that there's no level of accountability is because government and the people responsible for this, I think some of them are quite aware of the mistakes that they made and the damage that they've done to families and to elderly people, are quite aware of that. So there is a real incentive to keep pushing us down this road. And every step that we take down the road seems to reinforce the previous steps, and seems to reinforce the notion that everything that's happened so far was kind of inevitable, and it was, happened in other countries, and there's all manners of kind of excuses, like wearing the mask, for example. It's an entirely harmless thing. It's not going to do any harm. And if you don't wear it, you might do some harm. But at the end of the day, people aren't thinking about when we wear the mask and when we do some of the things that that there is no point to doing, we're reinforcing a whole heap of previous steps. And some of those steps that are being reinforced, or some of those things that are being reinforced, is this abject neglect of the people who died and in the nursing homes. And that does seem to be continuing on today, because we have the capabilities and the science. We have PCR tests, but we've also got antigen tests. We've got certainly a lot of evidence to say that people who are exposed to the virus have a degree of immunity. We could have an entirely different approach looking after them. We should have had an entirely different approach from the outset. And when your first guest, Susie, spoke there, I mean, there was some heart-wrenching things that she mentioned there, driving up 4 or 5 hours from Kerry, standing out in all sorts of weather outside of a window, not having even basic access to be able to go to the toilet, and looking at, or perhaps having the opportunity to touch her father maybe through a window. I mean, horrible stuff and deeply inhuman stuff. But I think it all exposes an underlying ageism within the HSE, within the Irish state, and perhaps, dare I say it, and it might be unpopular, but I think within society in general, there's a real lack of respect for them, and they still are a them,
Marcus,
and
so where do you think we are now? One of our watchers has asked what you would think about what's going on now, and whether the talk that we are now hearing that there's another virus in England, what do you think is going on now, and how do you think we can get out of it?
Well, we've always had, I think we're a little bit like Dorothy with the red shoes, when she kind of goes through the Lion and the Tin Man, and they go through the witch and everything else. And when she finally makes it to the wizard and he says, well, look, you've got the red shoes on, all you need to do is click your heels together. That was a little bit of an anticlimax for me when I watched The Wizard of Oz, because I kind of said, geez, all she had to do was click her heels together at the start. She could have avoided all that mess, I think where we are is that, unfortunately, we're at a point where the counterfactuals, the contradictions to much of the nonsense that's going on, are being entirely ignored. And and when I say counterfactuals, I'm not talking about crazy anti-vaxxers or right-wing lunatics or anything else. When I was a medical student, when I was an intern in the hospitals, and most interns today carry around a small book in their pocket, and it's called the Oxford Handbook of Clinical Medicine. And any medical student, if you say that, they'll know exactly what I'm talking about, because there's a department in Oxford University called the Department of Evidence-Based Medicine, and the chief professor there is Professor Carl Hennigan. And Carl Hennigan is the head of the Department of Evidence-Based Medicine. I take my cues, and I've taken my cues since I was a medical student, from much of what Oxford University has to say. Now, I'm not saying that they're the only people that we need to listen to in the world, but I'm saying that they're very, very reputable. They've been around for hundreds, if not thousands of years, and their influence upon human medicine and clinical medicine is very, very solid, very, very evidence-based, and very profound. But the Department of Evidence-Based Medicine at Oxford University, that department is designed to make sure that doctors like me, community don't end up with big egos and want to start doing things that we just feel might be a good idea at the time. They are responsible for looking at the practice of medicine and saying what is evidence-based and what is not evidence-based. And a doctor who's practicing medicine that isn't evidence-based better have some pretty good bloody reasons to do it, or he or she is going to be in hot water with the potentially with the medical council or with anyone who complains about them. So my point is, my answer to the question is that the counterfactuals and the evidence is there. Professor Carl Hennigan, for example, he presented to the COVID-19 Dáil Special Committee on the subject, for example, of masks. And he said quite categorically, quite emphatically to the Irish government that masks, particularly cloth masks, what people are wearing, are a total waste of time. And they may actually cause more problems than they solve because they cause spots around the face, acne around the face, and facial infections, skin infections, and they're filthy dirty. They're full of secretions and everything. So where are we going to get to by going over and over and over again these kind of counterfactuals? They're there, the evidence is there. Carl Hennigan has come out, the Department of Evidence-Based Medicine come out and talked about PCR and has talked about its use as a national clinical kind of a screening tool. This has never been done before in the history of medicine. And he's come out and he said categorically, look, the number of cycles that you're using in your PCR test is amplifying up the DNA that you're picking up people who might have walked past somebody with COVID and have a little bit of the virus in their nose and might have been exposed to it several weeks ago. All of that stuff, all of these things, the contradiction and even the Portuguese Supreme Court has come out. The PCR test was brought up and was questioned in the Portuguese courts. They went through the entire judicial system, I think up as far as the Supreme Court. They had independent scientific experts. And they've dismissed the use of the PCR test as certainly unusable in determining what is an infection and what is a case and that sort of thing. So, where we go and what we're going to do and what the future holds, essentially, we're in a kind of a state where we're ignoring all of the counterfactuals. So, for people like me, it's very frustrating because in Ireland, there's lots of good people. There's people like Ivor Cummins. There's people like Health Freedom Ireland. There's good organizations out there who are doing the groundwork and coming up with the counterfactuals. But the problem is that they're jumping up and down and they're essentially wasting their breath because the tsunami of public fear, and the government is feeding the tsunami of public fear and using this kind of, there's 27,000 cases in Ireland, and they're using very nuanced language to kind of drill and keep and drive the whole fear. So, there's many layers to this, but on a very basic pragmatic level, talking common sense to politicians or saying like where we should go and what should we do. We have the truth. We're like Dorothy with the red shoes. We have the evidence. We have the them. We know that the vast majority of people who are going to be sick with COVID are elderly and people with underlying conditions. So all of that is there. So how we're going to kind of get around this, I don't think we will, to be honest. I think this is going to be something that will have to be looked at through the retrospective glasses. Yeah. It'll be next year when we're weighing up the costs, when we're looking at, the 32 billion wasted in money and the size of our classrooms, and maybe some researcher will be looking again at Scandinavian countries and saying, they've only got 7 or 8 kids in their classrooms and we've got 30 or 40. Then someone will put their hands up and say, well, it's because we've spent all the money on COVID and that's why. It'll take a lot of time for us to get to the point where we can actually see where we're going wrong. But the solutions and the answers are there. They're obvious. They're just as obvious as Dorothy in her red shoes. But unfortunately, nobody wants to see them at any extent at the moment.
Maeve, you were saying earlier Maeve was saying earlier, and we can discuss that again, that in the home, your aunt was told, or the staff were saying that once the vaccine came along, everything could return to normal.
that kind of concerned me a bit, that it was perceived that her access to freedom in the future would be via the vaccine, and I would have serious concerns about getting an untested, poorly trialled, accelerated to market vaccine injected into my 89-year-old aunt. I honestly feel there's a lot of other things we could do before I would ever consider allowing her to have that vaccine. And I have written to them to say I don't want in any way, shape or form that she would be having that vaccine administered without full prior consent from the family. And that does concern me because, as I said already this evening, you know, there are very many really well-known and well-tested protocols, both prophylactic and curative. And they're out there. And it's like you say, Marcus, you know, this is already out there. Some eminent specialists who have had amazing results. There's a huge body of research. And I don't understand why the government and NPHET aren't looking at this, because, you know, it would be a huge relief to families to know that there's something there that, God forbid, if somebody does pick up this virus, that it can easily remedy it and help them, you know. So, I mean, from that perspective, I feel it would be something we should really be looking at as well. It needs to be top of the agenda for me anyway.
Yeah, well, I feel, I don't know what you think, Marcus, but I'm very nervous about these vaccines. I don't like taking any drugs ever, and apart from alcohol, and
And caffeine.
The odd glass of red
a
wine.
glass of red wine, but my little brain can't comprehend how they can bring forth these magic cures for everything in such a brief time. I don't know if you know have any inside info on it.
Well, no, look, I certainly don't have any inside information on the vaccine. You know, again, you know, I think that the word "them" and the vulnerable is, you know, is gone. It's out of the window. You know, it's not in the room. You know, and unfortunately, in Ireland, you know, there's a certain what I would call a post-colonial kind of a mentality in Ireland, that it's kind of, you know, there's a real sense of herd mentality, of following, and anybody who kind of, you know, speaks out of turn or speaks out of line, you know, really runs the risk in Ireland, until we've had kind of an awful lot of consequences. Like, I mean, here we are now, still at the pleading stage, and it's falling on totally deaf ears in terms of looking for a full inquiry into the deaths that occurred in Irish nursing homes. You know, when you kind of ask for things or say things or make suggestions that aren't part of the kind of RTE narrative, Irish people, I think we tend to be very, very quick to jump and want to crucify and you know, attack anybody who might suggest that, hey, are we doing things, or might have some questions to ask about things. And unfortunately, even when you even mention any sort of potential criticism about the COVID-19 vaccine, really you're gone, you know. Unfortunately, Irish people en masse will start switching off computers and shutting out the lights and pulling the curtains, and they're afraid that someone's going to kind of rush into the house and tattoo them as an anti-vaxxer or something, you know. So I think we're really in the wrong country, unfortunately, I believe, to have any sort of sustained, open and honest debate about the COVID vaccine. Because, I mean, I read an article that were in the Irish Independent quite recently, where there was a journalist talking about HFI and talking about organizations that might question the vaccine. And the article was absolutely horrendous. Horrendous in the sense that it was so biased to this whole notion that essentially what the journalist in the Independent was saying, if you as much as open your mouth and say that there could be any potential problems with the COVID vaccine, then you're clearly a member of a far-right organization, or you're a fringe sort of a lunatic or something like that. And that's the way Irish journalism works. You know, it's anyone who questions this vaccine in this country is going to have a very, very difficult time preserving their own personal reputation, preserving their own professional reputation, because it's vicious out there. I mean, you know, you look at like Dr. Pat Morrissey, for example, who gave hydroxychloroquine to some very, very sick patients with COVID-19 with their full consent, and trying to help them and doing everything that a doctor, that following ethical and moral and guidelines would do. And you know, he was vilified, pursued by the Irish Medical Council, you know, in the same respect myself, you know, for simply for showing up at a protest about masks, and I was pursued and still am, you know, pursued to a certain degree by the Irish Medical Council, you know. So it's absolutely vicious. The Irish medical profession is a very, very dangerous place if you speak outside of the narrative. But certainly, once you mention any question about vaccines at all in Ireland, you're gone. This is golden juice. It's coming from heaven. Holy God himself has invented it. And every man, woman, and child, cat and dog in the country should be getting it in every arm, leg, orifice that they can, because it's absolutely wonderful stuff. If you don't follow that line, you're in big trouble. You're playing a very dangerous PR game, you know.
Could you explain, one of our watchers has been asking whether you'll be prescribing the vaccine, which leads me to question also how doctors are going to handle vaccines, given that some of them seem to be refrigerated at crazy type of temperatures and so on. How exactly will they, to use their horrible expression, roll it out?
Yeah. Well, to answer the first question, I certainly won't be giving the vaccine because I've resigned. I resigned from the medical council, but after the medical council started to pursue me for showing up and for speaking about masks, or reiterating what Professor Hennigan was. After that, I also resigned my HSE contract, so I'm no longer contracted by the HSE. As from January 15th, I've resigned from the HSE because I can't reconcile my own sense of ethics with what's going on. And I don't mean that to kind of blow my own trumpet and say I have a very sophisticated sense of ethics. I don't, you know, I'm an average Joe when it comes to my ethics. But in terms of giving the vaccine, one of the reasons that I resigned my HSE contract was the nasal flu vaccine, and giving that to all children willy-nilly. The advice that was coming from the HSE that it should be given to all kids, this new novel vaccine squirted up their nose, in a reality where we don't have children suffering from COVID-19 and dying from it, and yet, you know, being placed in that horrible, compromising position. You know, certainly I won't be giving the COVID vaccine, but I won't be giving it on ethical grounds, and I won't be giving it because I won't be a HSE employee when it's administered. How they're going to go about administering it, I mean, that's fairly simple. I mean, the European Central Bank has said, listen, it's 0% interest. You guys can have as much money as you want. So the Irish government is just simply borrowing. So in order to set up central offices in towns, or dispensing centers in towns, and have trucks coming in and vaccines in liquid nitrogen, there's no end to the amount of money that the government is going to hand over to the drug companies in order to keep this whole show on the road. And there's no big demands for it to be paid back at the moment. So the present government that we should see out their tenure in the next 4 or 5 years without any kind of financial consequence to all of this. So it will be dispensed very easily because the money is there to do it. I mean, the money has been there to, you know, to bribe huge sections of the population, like my own profession, you know, and to bribe, you know, our young people with COVID payments, and to kind of, you know, it's a very, very lucrative business for doctors, for Gardaí, for state workers to play along with the narrative. It's very, very extraordinarily lucrative. It's very dangerous, professionally dangerous, if you don't go along with the narrative. So the money will be there to dispense the vaccine. There will be plenty of people queuing up to do it because they will be paid very, very well to do it. So, this is all, I think, an inevitability. It's part of a process that's going to happen. And, I really don't see any kind of potential kind of difficulties on the road for them to dispense the vaccine.
Okay, well, it's interesting that you should bring up that we're coming to the end now. So last May, Leo Varadkar said, to get back to our main topic of the night, which is nursing homes, Leo Varadkar earlier this year pointed out that the nursing home model, if you like, wasn't really working, and that other countries are now going towards residential, trying to keep people in their own homes, in the whole community. And of course, wouldn't it be lovely if all that money that's been poured down for an absolutely, from my viewpoint, pointless vaccine, if that actually went into developing community services for the elderly so that they can stay at home. Because as you rightly say, Marcus, there's loads of money, massive funding from the World Bank and quite a big chunk from the European Investment Bank from what I can see. So, I mean, I think it all comes back to respect for people, doesn't it, really? And I think we're going to have to leave it at there, I'm afraid. So thank you very much for a very interesting discussion. I think everyone will agree that the nursing homes, as you rightly say, we should be looking after them, of which I'll probably be one fairly soon myself. So I have a personal interest in them.
That's the ironic thing, isn't it, Lindy? That
we'll all be there.
One day. We'll all be there, Yes.
Right. Well, don't forget that this programme was brought to you by the Healthy Debate. It's produced by a band of volunteers, mostly from Health Freedom Ireland and the Irish Inquiry. Thank you to our producers, Stephen, and we're in Stephen's dining room tonight, actually, and Sarah, and also to Danny and Steve, our technical experts. And all of this, as we do point out, the lights, the cameras, etc., it costs a few bob. So if you feel you would like to help us out, there's a donations page on the Irish Inquiry website, but no obligation, of course, just if you feel like throwing us a few bob. Good night and see you next week.